Hi, and welcome to all of those of you who are joining us for the first time. Welcome back to those who are joining us for the second time. Yes, my name is Liz Lamb. I'm on contract from Impact BC to provide QI, quality improvement support, to divisions, especially to support a GP for me. So please feel free to get in touch if there's anything I can help you with. I have had a few years of learning, leading and facilitating improvement events and leading healthcare providers through changes using various tools and models, and I'm delighted to be able to share that with you today. So by the end of this webinar, hopefully you're going to be more familiar with QI in order to provide leadership to the planning and implementation phases of your GP for Me initiatives. We're going to cover the importance of leadership in QI, introducing a framework for leadership of improvement, and then I'd like to take you in a very practical way, assessing where you are in your QI journey and outlining some of those strategies that you can use that will help you move towards a culture of QI, which is basically what we're after here. Now, if you Google this, you'll find like 20 million hits on QI and leadership. So I'm really wanting to bring us back to the IHI model because it not only applies to the organization as a whole, but it can be applied at the divisions level. And ever being practical, I just want to give you something that you can use to move forward. So firstly, the importance of leadership in quality improvement. Now, I know this is a long sentence. Bear with me. It's great. Leadership in QI is about creating a shared vision, aligning improvement activities with the vision, building will by engaging others to generate ideas, execute change, and nurturing a culture in which to grow and sustain improvement efforts. This really is the cornerstone of what I think leadership in QI is. I think I'm going to introduce a model shortly that I think really reflects this statement very well. You know, typically those organizations that have success in QI understand that effective leadership is it makes all the difference here. So we're talking about changing a mindset here for a leader of improvement. From treating the symptoms to treating the disease. From selecting areas for remedial action or reward to looking at improving the performance of the overall system. And it's from firefighting and crisis management to dealing with the chronic issues that lead to poor performance. And I really like this slide. This is from the NHS. It makes me think of the overall health of the system that we're dealing with, and it's a familiar model to me. And I think it really is a different way of thinking to one we've probably been used to and familiar with in healthcare. I'm going to play a short video. This is from Don Berwick, who's from the IHI. So just bear with us while we load this one up.
Leadership has been the constant drumbeat, the pedal point issue in all of improvement. I didn't know that when I started, hardly knew it at all. I heard Dr. Deming, W.H. Deming, talk about it. He had the 14 points for leadership, and point 1 was constancy of purpose for improvement among leaders. Yeah, I thought it was a little, rhetorical, and I thought, well, why? I can improve. I can be better at, bicycling if I just work at it. So we all can. No, it's not right. What we have learned and relearned is that, yeah, individuals can improve individual games, tennis or golf, but to improve healthcare, this interdependent system, let alone health itself even more so, only leaders can set in place the context, the support, the encouragement, the insistence, the vision, the regular attendance that allows improvement of complex systems to occur. And when the board goes to sleep, and the executive goes to sleep, and the chief of medicine or chief of nursing go to sleep, the system will go to sleep. And I've often said I wish that weren't true. It would be so much easier if we didn't have to have this constant attention of boards and executives and clinical leaders to improvement, but we do. We really do. How's that changed? The fact was always there. no more now than in the past. Maybe now there's more awareness of this in leadership circles. IHI's efforts in board training, executive leadership development, the fellowships, they've thrived, and they've thrived because more and more people realize that buck stops there.
I like what Don Berwick said, that, the buck stops here, and that's why it's crucial that there is more and more focus on the boards and executive director training in order to be successful. So let's look at the organization as a whole and what's needed. We start with the broad statements of mission and vision, but we have to get to the specific results that we want. We have to follow both these paths. And on the left-hand side, we have the strategic path, what needs to be done, the strategic goals the organizational work towards, and the objectives that must be accomplished to carry out those strategies. And these activities must be performed to meet those goals and objectives. And then the right-hand side is the cultural side. We have to pay attention to both of these, how things should be done, the values that guide people into carrying out the mission and vision, and those practices and day-to-day behaviors that represent those values as people go about their work. So what I'm going to focus on now is introducing a framework for leadership of improvement. This is from the IHI, and we will send out these documents afterwards so you can refer to them yourselves. So the first part of this model, set direction. It's about creating that shared vision and aligning the improvement activities with that vision. We have to push to make the status quo uncomfortable, so there's a need to change, and we also have to pull to make the future attractive, so people want to. Then we have to really establish a foundation. We have to build the will, generate some ideas, and execute the change. So I'll break these down into the sections. To set direction, we need to write some statements that reflect the fundamental purpose of the division. It's the overall aims and activities of the division. A mission statement might answer these kind of questions. What is the division's purpose? Who are we? What do we do? And what's our role? Then we have a vision statements. What do you want to become? Describes your kind of ideal future, the destination, and this is really about having that shared dream. And the vision statement might answer, what is success going to look like to you? How do you want to be viewed by the community? Strategies, how you plan to get there. The quality improvement development and resources should be built right into it. And all of this has to be communicated to your stakeholders and your staff. Next one is about establishing that foundation. And again, this is more of the cultural side. It's about the values. Define the culture you desire. And speak those unwritten rules that you want to see. We have to build improvement capacity. We have to develop the staff and get them involved. Secure some resources. And this is important. Prepare personally. Ask whether you're the right person to lead. Identify what you're going to need to get there, and then seek it out. You have to choose and align your senior team. You're going to look for the right set of skills and commitment to make this happen. And you want to build relationships, especially among your employees and your stakeholders. And really important, develop your future leaders. If we want to get to a culture of QI, we have to make sure we identify and support those people who are going to continue to champion those values for you. Building will. We have to plan for improvement. We have to integrate the planning into the strategies and get some priorities. We want to set aims, write improvement charters, those kind of things, so that you're really clear on what you want to achieve, and then make sure the resources are lined up to support staff so they can practice this. At some point, we have to measure performance. We have to pick some key measures that might be able to tell you if you're going to be successful, a little bit like the model for improvement. And please provide encouragement. It is difficult. We want to be able to show appreciation for efforts and results and really treat people with respect. Another piece in this model is make financial linkages if you can. So tie the improvement efforts in with some value for the patient, or maybe it's a reduction in errors or something that costs time and money. It's going to build your will. And then we have to focus on the larger system. So think big. Think about how the transformation of the wider healthcare system. Generate ideas. For me, this is the fun part. We learn from others. We look into, maybe if you can learn from others and look into the prototypes, those who've had some wins. Again, we're looking at best practice and research. Use benchmarks. Try and find out what knowledge there is out there that might work for you. A great source of information is listening to your patients. If we can involve them in their care and capture their voice, their concerns, they have some fantastic ideas, if we can just find a way of getting there. Invest in research and development and manage those knowledge systems. So we're really looking to find a way of sharing that knowledge and organizing the ideas that have been tried, really tapping into these resources. Lastly, to execute change, and this is where the model for improvement comes in, or some kind of standard approach that everyone can follow, and train people in it. Start to use the language, start to work through that process every time you're thinking about executing a change. If we can review and guide that process, really keep a close eye on how that change initiative might be progressing. So meet with the teams and use coaching. Coaching is really valuable in this to build that capacity. Once we have our ideas, think about how you can transfer that knowledge to others and try and find a champion or mobilize social networks, something where you can help that spread. And again, communicate your results, share the ideas, the learning. If we can communicate openly, both inside and outside of the organization, it's fantastic. Just be transparent. And then lastly, sustaining improvement. In my opinion, this is one of the most difficult pieces to actually make it stick. We have to really try and make it difficult to revert back to the old ways. And it'll only really happen if there's something in it for those who have changed. It has to have changed for the better, not just change for change's sake. So now I want to move on to the next piece, which is trying to assess where you are currently as an organization or a division, and thinking of some of those strategies to move you towards a culture for quality improvement. Now, I'm going to refer to a couple of tools which we will give out at the end, and this is really only a snapshot. So I think it's really important to know what a culture of QI actually looks like. We need to know what we're heading for. So we're going to look at some of the human and process characteristics of the journey, really, that you're on, to have some idea of the strategies that can be used to move you on to the next stage. So it sets out 5 stages. When you're just beginning, and this could be whether your division is just forming or your chapters are just forming, to developing, starting to use some of these and then making some progress, and then getting to a point where there's significant impact from your improvement activities and heading towards that QI culture. So let's talk about some of these pieces here. So we've all started here at some point. And I've definitely felt this before in some of the organizations I've worked. QI is viewed as a flavor of the month. And right now there isn't much around to learn from. So there's very little improvement shared, learning from improvement shared. And then some of the process side, we don't always see these clear organizational goals and limited time and resources for QI, and data isn't routinely used to inform those improvement activities. So some of the strategies they suggest for moving forward: identify those natural QI champions, those people with those values and those ambitions that you want. Share external success stories with staff. So there might not be those internal ones, but start to share the external ones. And include quality improvement in your mission statement. Seek out those resources and offer QI training opportunities to your staff. And then start to really think about identifying data and sources. We are going to need to, I push data a lot, but you're really going to have to start to think about where you can get this. As we move through to developing, where you're kind of starting to use these tools, we still might see that it's viewed as an added responsibility, and I hear this all the time, you know, people don't have time for it. But staff are also very anxious about implementing QI incorrectly, or whether it's going to be used to uncover negative performance. And this is really important. It's not about judging. For the process side, we start to see that leadership has set these clear improvement goals, and resources are starting to become available to provide that support. And data is starting to be used to actually support some of the improvement decisions that are going to be made. So some strategies again for moving on. Communicate to staff that QI is within their reach. Encourage and share those small successes that you have, so those small wins, and then start prioritizing goals. And if we can all start reporting those results of QI efforts to leadership, they're going to start to see how it fits with the organization. And start discussing again, data, start discussing what should be collected. So making progress now, we've probably adopted one or some of the QI models, and it's being implemented in specific areas, but it might not be incorporated into the organizational-wide culture yet, but we're certainly making progress here. So at this point, we start to see leadership viewing people as critical to success. It's about the people in your organization. We might have a few QI champions, and they might be part of the system for sharing that learning. And then for process, you know, our leaders might prioritize some of those organizational level goals, those higher ones, and they're going to actively monitor and support those. And then we're starting to see, again, data-driven decision-making used over firefighting. We're starting to monitor the whole system now. To move forward, routinely share learning and offer training to staff. It's really about promoting this as a learning organization. Develop strategic objectives and action plans that have QI really embedded deeply in there. And again, routinely report progress to leaders and staff. So make sure everybody's attention is on this. If we can link those efforts as well, we talk about multiple PDSA cycles, but we need to start linking those efforts and seeing, you know, maybe we've done 5 PDSA cycles and how have they all gone up to one goal. As we move to significant impact, we start to see a real shift now. The tide's turned. Quality improvement is really embraced by staff, not just the leadership, but staff. And sharing of best practice and learning is common. We see leadership actively engaged. They're monitoring and supporting most of the organizational level goals. And we're starting to see, as we develop more experience, we find there's more resources and staff time consistently allocated for quality improvement. And again, data is used to measure the performance of the improvement. So we can see how we're doing. So we still want to move forward though. Encourage frontline staff to produce QI ideas. So now we're starting to shift to the whole workforce now. We want to encourage everybody to start thinking this way. Role modeling and coaching is really important here. I can't stress this enough. Everybody needs to see from leadership what the behaviors and values are. And we can start to incorporate competencies of QI in job description. So we're drawing the right people into the organization as we go. We want to start evaluating processes and outcomes. And we will, again, talk about evaluation a little bit more in the next webinar. So a QI culture, this is our North Star. This is what we're trying to get to. And we see that quality improvement here, it's fully embedded into the way the agency does its business across all levels, all departments, all programs. Leadership and staff are fully, totally committed to quality, and the results of the efforts are communicated internally, externally. So even if leadership changes at this point, the basics of QI are so ingrained in the staff and the organisation that actually staff will start to seek out those root causes of those problems. They'll start to be problem solvers. They don't assume, that an intervention will be effective, but they will want to move towards those measurable objectives. They'll be able to try them. So the human side, all the staff are completely committed to use it and continuously to improve daily work. And we're seeing now a real vast knowledge and skills. They're strong across the majority of staff. And innovation and creativity is the way to go. For the process, leadership's actively engaged now in monitoring and supporting all improvement goals using data. And they're clearly setting improvement goals and expectations, priorities, and importantly, accountability. So there's at this point, the roles and responsibilities and accountability is really there. So this is the roadmap. Again, this is a summary from just beginning, developing, starting to make some progress to significant impact and moving up to the QI culture. So we're all on this path, but we're aiming for the best healthcare for our patients, and we want to make continual improvements. So refer to this guide. It is in more detail, as I said, but it does help guide some of those other elements, like how does leadership develop, and how do we use results, that kind of thing. So another short video. I'd like to just introduce this one on challenges.
Healthcare worldwide is facing a common set of challenges around the economic situation, the politics of healthcare, the demographics in the population, changing epidemiology. People are sick in a different way now to the way that we were designed for. People's expectations are changing, new technologies are changing, but that's the same everywhere. And what that means for us is that we have our opportunities to learn from each other are significantly enhanced. These are big, serious challenges, but none of us face those alone. And that I think is one of the things that IHI brings. That's one of the reasons as a healthcare leader I was drawn to IHI, because IHI is that convener of expertise from all around the world. It's the bringing together in networks of experts the best knowledge you can get. And my motto was always steal with pride. If I saw a great idea out there elsewhere in the world, I would want to bring it to Scotland. And if we had something we were doing well, I would want to share it. I think improvement's an open source thing. We should be, we've got the same problems to face. We should be sharing the solutions. The solutions to most of those problems exist in some part of the world. They just don't exist for every patient every time yet. And that's the aim.
So we've got shared challenges, economics and politics and demographic and changing populations. But I like his message that we can share the solutions. We have opportunities to learn from each other. Technology has moved on so well now that we really have a great opportunity to do this. So I hope that's been helpful to you. My contact information is there, and I hope you can join us in September. So thank you very much. I'm going to wrap it up there.